Hi, this is Melissa Jansen. I am doing my skills test for the Sputum Collection, IM injection, and sub-Q injection. So the first thing I'm going to do is the Sputum Collection. I have my cup available, and give me just a second. Sorry about that. So I do have my cup available, I have my gloves, and the first thing we are going to do is go into the room and let the patient know, hi, my name is Melissa, I will be your nurse this evening. The doctor has asked that we collect a specimen of your sputum. So next we are going to do hand hygiene. As I am doing my hand hygiene, I will ask the patient for the name and date of birth and compare that to the medical records. I will then put on a pair of gloves to protect myself. While I'm putting on the gloves, I will let the patient know what I need to be doing with him or her. So I will be removing the cup, or excuse me, the lid to the cup, and I will place it upside down on the counter. And from here, we're going to go ahead and explain to the patient that we need to get anywhere from 5 to 10 milliliters of sputum, not spit. We will have the patient rinse their mouth out with water and spit that out. We do not want to have the specimen filled with just saliva. It does need to be phlegm. From there, we're going to ask the patient to take 3 to 4 deep diaphragmatic breaths, and to let out on the fourth one, we're going to ask them to cough. And anything that comes up, we are going to ask them to go ahead and cough into the specimen cup. And again, we will need 5 to 10 milliliters of, excuse me, of phlegm only. Once they have produced enough phlegm to fill up to 5 to 10 milliliters, we're going to place the lid back on. We will go ahead and label the sputum cup with their name, date of birth, medical record number, time and date of collection. We will then place this cup in a bag and prepare to send it out. We will let the patient know that we appreciate their assistance. We will then do hand hygiene once again and let the patient know that their call light is right on their bed. If they need anything else, that they are able to give us a call. So that is how we're going to do the sputum collection. For the IM injection, we are going to compare the orders that the doctor has written for the medication for an IM injection, and we are going to get our supplies. First, we're going to need to get a 23 gauge needle, as well as our medication that we are going to pull from the Pyxis. We're going to compare the orders to the MAR, and once we've located the medication from the Pyxis, we will pull the medication and we will flip the cap off. If it is a new medication, we will take an alcohol swab and prepare the top of the medication by cleaning it with alcohol anywhere from 15 to 30 seconds. We will remove our 23 gauge needle and syringe from the wrapper. Pull back the safety cap. Pull the actual cap off. We are going to be giving 1 milliliter currently of this medication, so we are going to pull the syringe back to just a little bit more than 1 milliliter. And we are going to take our medication, turn it upside down, put the needle in the medication, and inject it with air. Once we've done that, we can then pull back on our syringe to 1 milliliter. Now that we have our medication in the syringe, we will not recap this. However, we will use the scoop method, which is, I don't know if you can see, but we will use the scoop method to pick the cap back up and recap the needle. From that point, we will make sure that the cap is back on completely. We will go into the patient's room, introduce ourselves. My name is Melissa. I will be your nurse this evening. I have a medication that the doctor has ordered for you, and I do need to give it to you intramuscularly. Can you please verify your name and date of birth? Patient provides the name and date of birth, and it matches according to our medical records. While the patient is letting me know that information, I'm going to go ahead and perform hand hygiene. Then I'm going to put on gloves. I will then ask the patient which arm they prefer, right or left. And this patient has picked the right arm. As I am looking at the right arm, I will go ahead and pull out my alcohol swab and clean the area extensively for a good 30 seconds. I will then ask the patient and confirm that they do not have any allergies, just to make sure that I'm not giving the patient any medication that they could possibly be allergic to. Once that is completed, I will do the Z-track method while pulling the skin sideways to make sure that I am getting the entire area. I will take the medication, remove the cap, and I will go in. I don't have my little thing. Give me just a second. I forgot this. But I will go ahead and do the Z-track method. I will remove the cap and I will go straight in like a dart with the bevel up. Go in, inject 1 milliliter, or excuse me, 1 ml, same thing, per 10 seconds, and the medication is in. Once I have removed the needle, I will go ahead and take my 2x2 gauze and hold over the area that the patient received the injection until there's no further bleeding. I don't see any bleeding. If the patient continues to bleed, we can place a Band-Aid on there. If not, then the patient is good to go. I will ask the patient if they need anything further. If they do, I will assist them with that. If not, then I will let them know that they have a call light and they can call me at any time. I will put the safety cap on the needle, and I will dispose of this in the biohazard container. Next, we have our sub-Q injection. And same thing, I'm going to go to the Pyxis and compare the orders to the MAR and make sure that I am giving the correct amount of either heparin or insulin. In this case, we're going to be giving insulin. I will pull the medication, which is going to be Humalog, from the Pyxis. I will clean the top of the medication vial for a good 15 to 30 seconds, making sure that I have removed all bacteria. I will take our sub-Q needle and I will remove the cap. And with sub-Q, you do not put air back into the vial, so I will go ahead and take the needle, put it into the vial, and remove 5 units of Humalog. With insulin, you have to be very careful that you are on point with getting the exact amount. All right, so I have 5 units of insulin. I'm going to use the scoop method and recap the needle. I'm going to go knock on the patient's door, introduce myself. My name is Melissa. I'll be your nurse for this evening. The doctor has ordered 5 units of Humalog, and ask them where they would like to receive their injection. As they're speaking, I'll go ahead and do hand hygiene, come over to the patient, again take my alcohol swab. This time they would like to have it in their abdomen on the right side. I'm going to go ahead and place this injection 2 inches away from their umbilicus, and make sure that there's already not any lumps or bumps in their skin, because insulin can sit under the skin for a while and cause hard lumps. So I'm going to go ahead and take a look. Once the patient is ready for the injection, I will then take the alcohol swab and clean the site on their stomach for 15 to 30 seconds, making sure that I am getting the entire area. Once that has dried, I will go ahead and take my insulin needle. I will remove the cap, and I will go ahead and place this into the patient's skin and inject the 5 milliliters of, 5 milliliters of insulin. Once that is removed, I will recap the needle by using the scoop method, and that is on there. I will get rid of this through biohazard container. I will hold the 2x2 gauze onto the patient's stomach, and usually with the insulin needles there's not a whole lot of blood that comes out, so I will do a quick swipe, check. There is nothing that is coming out, so it looks like the patient is good, and I will let the patient know that I am here if they need anything, and place their call light in within their reach. And if there's anything else that I can do for them, they can just ring their call light and I will be here for them. Other than that, that is it. Thank you.